Welcome. It's my pleasure today to have an interview with a distinguished colleague, Dr. Myron Allukian Jr. I'm going to give you just a brief introduction about Dr. Allukian, and then I'm just really excited to hear about his distinguished career. Dr. Allukian originally got his bachelor's degree in psychology from Tufts, and then he went on to get his DDS at the University of Pennsylvania, his master's of public health from the Harvard School of Public Health, and he is board certified in dental public health. Among his many, many accolades, he's a member of the National Academy of Medicine. He's a past president of the American Public Health Association, the second dentist to serve as president. He served as dental director for the city of Boston for 34 years. He's also served as a faculty member at Harvard, at BU, and at Tufts. And at Harvard, he has been awarded the Distinguished Alumni and Distinguished Faculty Awards. He's currently a trustee of the New England College of Optometry and the president of the Massachusetts Coalition for Oral Health. He's done many, many other things during his distinguished career, but it's my pleasure to welcome Dr. Allukian, and I have some questions to pose to you, Dr. Allukian. First, let me thank you for spending time with us today.
I'm very pleased to be here today, Dr. McCauley. I lectured at the University of Michigan many years ago in the early 70s at your dental school. It was a lot of fun. I enjoyed it.
Well, I'm glad to have you back, even if it's virtually. So let's get going. So I was intrigued. You were born of immigrant parents, neither of which graduated from high school. What made you decide to go to college and then to dental school?
It's a very long story. I'll try and make it short. My mother was a Armenian genocide survivor. When she was about 8 years old, there was a knock on the door. It was the Turkish police. They said, "Where's your father?" She said, "In the other room." They took him away and killed him. Her mother was left with 5 children, 12 and under, and pregnant. Long story short, she ended up marrying my father many years later. And although neither had finished high school, they taught me some basic values about being honest and being kind to others. I was brought up in the inner city. I didn't have a clue about what college meant. I thought only rich white kids went to college. And while I was in the 6th grade, we were at dinner and I told my parents I'm not going to see 2 of my best friends anymore. And they said, "Why not?" I said, "They're going to Boston Latin School." They said, "Why are they going there?" I said, "That's where smart kids go." And my older sister said, "Well, why don't you go there?" I said, "I don't know." So I ended up at Latin School. And at Latin School, everyone's applying to college. So I said, well, they're smart. They want to go to college. I'll go to college. So I asked my father, I need recommendations. He said, "Why don't you ask Mr. Jones around the corner?" I said, "Why Mr. Jones?" He said, "Well, he speaks good English." But that's the culture I was in, parents who didn't know any better, but they taught me basic family values. I had an interview at Harvard, and I was very naive about what it meant to go to college. And the admissions director said, "Well, why do you want to come to Harvard?" I said, "Because it's on the trolley car line. It's easy to get there." That's honest. Now, I didn't get into Harvard. I ended up at Tufts, and I was a psych major at Tufts. And I've been on the Harvard faculty for over 50 years, which is another story. So while in dental school, while at Tufts, I was thinking of being a psychiatrist, but a recent study came out that said whether you get psychiatric treatment or not, your outcome was the same. So I ditched that. And as a kid, I hated dentists. It was torture. In those days, they didn't use local anesthesia. I would sit in the dental chair and say, how can someone have a job where they torture little kids like me? Hated dentists. When I was about 8 or 9, I had a growth between my 2 front teeth. and it was like a third tooth. I had that removed surgically. I had orthodontics, and I saw a dentist who was helping people without pain. I said, gee, that's a great way to be a dentist. When I finished college, I had an opportunity. I applied to a number of dental schools. I had an opportunity to get a ride out to the West Coast with my cousin, who had a job at a new firm called HP in San Francisco. I said, drop me off at Muscle Beach. I've always worked out my whole life, gymnastics, acrobatics. I'll be there for a week, I'll come up. I spent the whole summer at Muscle Beach. And I was doing acrobatics, gymnastics every day. I also tried to get into the movies because I had juggled professionally in nightclubs while in college, and I started right after high school. And I lived from hand to mouth in California. I spent $30 in 3 months. I begged for food at the beach. I'd go into a supermarket, eat a few grapes, and walk out just to survive. I hitchhiked everywhere. I got a telegram one day toward the end of the summer, and I was living somewhere free in one of the fraternities. And it was, my parents said, someone in Philadelphia is trying to reach you, call and collect. So I went to a phone booth, I called collect, and the fellow said, my name is Dr. Breslow. I'm the dean of the University of Pennsylvania Dental School. He said, do you want to come to Penn to dental school? And I said to myself, if he could see how I looked right now, he would not ask me that question. And I said, well, do I want to be a dentist? And because I always worked out, I was interested in body, I said, well, I got to do gross anatomy, I learned biochemistry. I can always drop out if it's a hassle. So I said, okay. He said, be here in 2 days. We start in 2 days. I went to the beach. I said to my friends, I need to borrow money. I'm going to take a plane tonight. They said, where are you going? I said, back to Boston. I'm going to dental school. No one believed me. They gave me the money. I got a haircut from one of my friends who was a barber, retired. And I flew back to Boston, drove the next night to Philadelphia, got there at 6:30 in the morning, and I was in line at 7:30 to register and start.
That's amazing. That's an amazing story. And we're going to come back to Muscle Beach, but I'm curious, once you were in dental school, I assume you thought at some point you'd go into private practice. So I'm curious, what changed your direction to go into dental public health instead of private practice?
I'm a senior at dental school, and I'm trying to decide, what do I do next? Now, while a senior, we had a lecture from the father of a dean who became dean later, Walter Cohen, a great person.
Yeah, famous, yeah.
His father presented a lecture about school health, and he played a tape on fluoridation. And I said to myself, interesting, but has nothing to do with me. I'm going into private practice. And then we also had a lecture from an epidemiologist, and they just linked tobacco to lung cancer. And he talked about all these studies around the world as an epidemiologist. I said, gee, that's an interesting field. Has nothing to do with me. I'm going into private practice. So I looked at my options as a senior. Do I go in the military? Do I get more training? Do I go into private practice? I couldn't afford to go into private practice. I didn't want any more training. And I definitely didn't want to go in the military. But thinking and thinking, I said, well, if I go to the military, at least I'll get to see the world. So I decided to go into the military. My first 3 choices, Japan was first choice, Mediterranean was second choice, and Hawaii was third choice. I said goodbye to my girlfriend in Philadelphia. Where do they end up sending me? The Philadelphia Naval Base. Was I unhappy? Very unhappy. And at the Philadelphia Naval Base, there were 14 captains, which was 4 stripes, and there were 14 lieutenants, 2 stripes, right out of dental school. All we got to do were amalgams. We were an amalgam line. All the perio I learned, the endo, prosthetics, couldn't do anything, just amalgams. Very, very boring. And I was always looking to improve things while there. And the inspector general came after I was there 3 weeks. And you line up in the morning, and the commanding officer said, does anyone want to meet with the inspector general? And a couple of captains raised their hand. I raised my hand, and they look at me like, you've only been here 3 weeks. Why do you want to meet with the inspector general? So I met with him. It was scheduled for 15 minutes. I was with him an hour and a half. He was a Penn graduate. His name was Admiral Raffetto, and he asked me about staying in the Navy as a career. I said, are you kidding? This is terrible. I told him all the problems as a new dentist. Well, from that point on, my life was never the same. After he left, they made life very, very difficult for me. And I learned from a new captain who came in that hit it off that if I volunteered for the Marines, I would get to go to Okinawa, which is a beautiful island. He said, Okinawa, you'll love it. So I did that. I got orders within a week. I'm at Camp Pendleton, going through basic, crawling under barbed wire, shooting a rifle. And the instructor kept saying, when you're in Vietnam, the VC do this and the VC do that. And I said to the physicians and dentists, I said, why is he talking about Vietnam? I'm going to Okinawa, you're going to Japan, you're going to the Philippines. Well, I ended up in Okinawa. When I got off the plane, I kissed the ground. I was so happy to be in the Far East. Simple living. When you're with the Marines, it's very simple living. 1 week later, I go to breakfast. Half the camp is in battle gear. I said, what's going on? The president called the first Marines to go to Vietnam. And I said, you stupid idiot, you volunteered for this. You're in the prime of your life. You haven't really practiced dentistry. You're going to get killed in Vietnam. I went a number of months later. But the nice thing about being in the military, when I was on my own with 2 other kids right out of dental school, we could do all aspects of dentistry. We had our own lab tech, and I could practice as a complete dentist. And it was a very good experience. I also took up Judo in Okinawa because I had wrestled in college. We ended up winning the All-Island Championships. I got my black belt in Okinawa. I was the only Caucasian in the room. 300 Okinawans. They were all yelling and screaming in Japanese to help my opponent. And I ended up winning my black belt. It was very exciting. And I learned a little Japanese while I was there. Well, then I'm sent to Vietnam. I get off the plane in Da Nang. It's hot, hot, hot. And I looked around, and there were about 10 or 12 barbed wire fences, high, machine gun nests. And I said, well, I'll be safe here at the Da Nang base, air base. And they said, well, you're not going to be at Da Nang. You're going to be at the Marine Field Hospital. I said, oh. And to myself, well, I'll even be safer in a hospital. And they took us out in the middle of nowhere. There's a little fence, barbed wire fence, 2.5, 3 feet high, and a couple of tents. I said, what's that? They said, that's the hospital. I didn't have a clue. I didn't have a clue of what a military field hospital was with the Marines. All the mass casualties would come there. Now, my first week there, it was like camping out. And I said, this isn't so bad. Then one night, in the middle of the night, about 2 or 3, I hear boop, 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 and my tent is going up and down. And it's a chopper landing. It was our first mass casualties. And about 20 or 30 kids, young kids, 18, 19. (18, 19, 20) killed, shot up. There were only 3 physicians and 14 dentists. So we had to help keep these young kids alive and stop the bleeding. And fortunately at Penn, I had an excellent education and I had a good understanding of the human body. In those days, there were 4 dental students to a cadaver. So you got to do everything you wanted. And I dissected the whole body because I was so interested in how the body worked. I made the first incision with my peer dental students. They were afraid to make it, but it was just a great learning experience. So I was very comfortable. You know, you have to learn how to stop bleeding and debris, et cetera, et cetera. After we treated all those kids and helped them out, we learned that the mortars were falling right where the officers were, where the ammunition was, where the communication tent was. And the VC who invaded them at night were the Vietnamese who came in during the day, who shined their shoes, cut their hair. So from that point on, the Marines never let the Vietnamese on any of their bases. We then dug our foxholes. Many of them got shot or killed running to their foxholes 20 yards away. We dug our foxholes right next to our cots, and I probably had one of the deepest foxholes there. That was the end of the vacation in Vietnam. Every couple of nights we get mass casualties, and probably the worst was in August. It was Operation Starlight. We had over 250 mass casualties, limited staff, and just bodies. Just bodies all over the ground. Young kids, 18, 19, 20, 21. And I said to myself, what kind of country do we live in? The richest country in the world. And this is how we treat our military and our wounded.
That sounds really devastating.
Yeah, it was horrendous experience, horrendous experience. Well,
but you had some good things too that happened from that.
Yeah. Let
me share this and tell us about the volunteer work that you did.
Okay. Well, the mass casualties came at night. We treated dental patients in the morning, and in the afternoon we were free. So I started looking for a way to volunteer, and I found there was a Catholic orphanage in Da Nang. They spoke French. I knew a little French, and I started going there on my own, treating the orphans. We ended up going to all 3 orphanages. We also went to the refugee camps. And at the Buddhist orphanage, the kids would sing a thank you song at the end of the day. That thank you song went through me. If you could show the next slide, please. That thank you song went through me from head to toe. And I said to myself, this is the kind of dentist I want to be, who makes a difference in the lives of human beings. Kids who suffer with pain and suffering every day, unnecessarily, like I suffered when I was a kid. So I said to myself, when I go back to the States, I want to go into international dentistry and work in developing countries. So that was my goal.
So this is you right here.
Yes.
Yeah.
And that's also me in the middle in front of the ambulance. Yeah, right there. So when I came back to the United States, I talked to a couple of my friends about being involved in international dentistry. And one of them said, why don't you talk to Dr. Dunning at the Harvard School of Dental Medicine? He was the former dean there, and he chaired a department called ecological dentistry, which is dental public health in English. And I met with him. I showed him my slides and what I did. He said, well, why don't you go into public health? I said, well, what's public health? I didn't know what it was. So he explained it to me, and they had a 3-year postdoctoral program at Harvard, 1 year at the School of Public Health, 1 year residency and research, 3rd year. So I entered that program. While at the School of Public Health, it's mostly physicians. There are only 2 dentists in the class. In one of the courses, maternal and child health, we were asked to write a paper on anything we wanted about prevention. So I decided to write a paper on the prevention of oral disease. How do you improve the oral health of a community? I did my literature search, and I found that the only thing that really works to prevent a disease is community water fluoridation. Everyone benefits. 50 to 70% less tooth decay at that time in fluoridated communities. 6 times more individuals caries-free. Fewer 6-year molars lost due to tooth decay. So Dr. Dunning liked the paper. He showed it to the executive director of Mass Citizens Committee for Dental Health. And she said, you want to speak at a Board of Health meeting on fluoridation? She said, this is an excellent paper. I said, sure. I spoke at a Board of Health meeting. Now, mind you, now I'm just graduating from the School of Public Health, getting to go into a residency. So I spoke at the Board of Health meeting, and people got up and spoke against it. And I said to myself, what are they, nuts? Don't they know the science? And they're claiming, one of them claimed it was a communist plot. And I'm saying that's ridiculous. Well, long story short, the Board of Health supported it. Then they asked me to speak at town meetings. So as a resident, I'm speaking at town meetings and Board of Health meetings about fluoridation. My life gets threatened from someone in the audience. Mass medication, you're going to kill us. It's a communist plot. And I'm saying, I can't believe you have a sound public health measure. And there are people who think it's a communist plot, or that we want to mass medicate it. And one of the items, well, today it's fluoride, tomorrow it's Thorazine, you're ruining our lives.
I think it really is interesting how, the whole idea of water fluoridation back in the day was controversial. And the thought of even trying to institute something like that now that hadn't been in place seems to me absolutely impossible. And fluoridation, it has continued to come under fire from time to time over these years. What would you say your most memorable experiences were in support of water fluoridation?
Well, I would say I had several. One is while I was still a resident at Harvard, I was asked, Dr. Dunning asked me to speak at a hearing to change the fluoridation law. Up till then, you had to have a public vote. This law would allow a Board of Health to order fluoridation. And I said to myself, gee, I'm just a resident. You have the president of the medical society, a head of major hospitals. You have the health commissioner. Why would anyone listen to a resident talk about fluoridation? So what I did was, and having been in show business, you got to find a way to get your audience interested. I looked at the data, and the data showed me that the average Massachusetts teenager had 6 times more tooth decay than the average Vietnamese teenager. I was shocked. We're in a city that has 3 dental schools, 3 medical schools. I couldn't believe it. So that was part of my testimony. And I said, we have an epidemic in our city, in our state, and fluoridation is the only way we can do anything about it in a meaningful way that everyone is going to benefit. Children and adults, low income, racial minorities, cultural minorities, and everyone benefits. That law passed, so I was involved in that. I also spent 8 years trying to get Greater Boston fluoridated, 32 cities and towns, 2.5 million people. There were 70 bills in the legislature to block or stop it. We beat them all, and we got Boston fluoridated. When I used to go into the Boston schools as the city dental director, we would see kids with abscesses in their mouth. I would see 4-year-old Head Start kids with pus coming out of an abscess in their mouth. And I talked to the mother, and she'd say, my child doesn't sleep, doesn't eat. I went to a physician, we can't figure out what's wrong. I said, look in her mouth. The physician never looked in the mouth. The mother never looked in the mouth. I would see kids with 6-year molars, no 6-year molars, just little white spots, specks of enamel left, the crown broken down. 90% of the kids I screened needed dental care. I think 25 to 30% were in pain and infection. When I'm in the assembly room talking to 300 kids within the last week, that many had pain or infection. And fluoridation is. So we helped Massachusetts go from 7% to 63%. So today over 4 million people in about 140 communities. I was also instrumental because of all these experiences I had with the Yankees. I was invited to a meeting of the National Academy of Sciences where they had the top health experts in the world talking about preventing heart disease, cancer, and stroke. I was the only dentist there. Mm. And after the first presentation, there are 400 experts from all over the US and the world, deans of medical schools, heads of hospitals, the AMA power structure, the American Academy, all these great, I'm the only dentist. So at the end of the first presentation, I raised my hand. I said, gee, no one talked about the most common disease in our country that can be prevented very easily. And they said, what's that? I said, fluoridation. And they're looking at me like, tooth decay, who cares? You know, not their issue. I stood up at every session from that point on, said the same thing. Halfway through the meeting, the Assistant Secretary for Health and Surgeon General came up to me. He said, Dr. Allukian, we got it. We're going to include fluoridation in the national prevention objectives. And then a couple of months later, he made me the chair. So fluoridation was included into national objectives for prevention for 1990. When we met as an advisory group, we said, well, let's not make it fluoridation. Let's make it fluoridation in dental health. Let's include periodontal disease. Let's include injuries and other dental diseases. And a fellow who ended up becoming the dean at UCSF, Dr. John Green, was then the deputy surgeon general. So we broadened it to make it dental health. So we got it in. Then the Healthy People 2000 was coming up. We had to fight to keep oral health in again. I was the incoming president of the American Public Health Association. I got APHA very much involved. We got the dental community involved. So we kept it in Healthy People 2000. And oral health has been in there. It's now in Healthy People 2010, 2020, and 2030. But it's because I raised my hand and asked the same question. And I was with non-dental people, physicians who only think of the body and they cut off the mouth. And so we were able to integrate oral health into total health.
It's a really important lesson,
Yeah.
you know, just raising your hand and speaking out for something that you have a passion about, but also really strong evidence to support.
Yeah.
That's really amazing.
Well, one of the things I learned in my career, if you don't ask, you don't get.
Yeah.
And I always tell my students, and I've lectured thousands of students, there's no such thing as a dumb question. You're here to learn.
Mhm.
And you don't want to leave a class or a dental school with, gee, I never learned how to do X, Y, Z because I never asked the question. Everyone else knows the answer. I don't. And
Yeah.
then you have that deficit in your career and your skills unless you make it up. So there's no such thing as a dumb or foolish question.
And there's always questions to ask, even after you leave school. So to change direction a little bit, I want to circle back to Muscle Beach.
Okay.
Because you've always been a really strong advocate of personal health and fitness, and that has really impressed me. I would love to hear from you how your view on your own personal health and fitness, how that's supported your ability to be so accomplished.
Okay.
And while we're doing that, I need to share this phenomenal photo. So this is Muscle Beach.
Yes.
Right.
Just so people don't get confused, I'm the person in the middle of the people there.
And so circa what year is this?
This was 1960.
Okay.
1960.
And
Santa Monica. This is the original Muscle Beach in Santa Monica.
And briefly, a few words about Myron the Mystic.
Okay. When I was a junior in high school, they did a show, National Honor Society Review, and I had done some juggling. So I juggled in that show, and I also brought in the trampoline, and we did some trampoline that went over very well. And then the senior year, they're doing a show again. Now, as a kid, I hated jugglers. I thought they were always very boring. So I'm in my father's meat market, and I'm saying, gee, if I do the same juggling, it's boring. I got to find something different. So I'm chopping some meat, and I'm holding a meat cleaver. I said, I got it. I'll juggle meat cleavers. So I juggled in that show my senior year meat cleavers. My mother almost died in the chair. She had never seen me do that before. And then I was in a show called Community Auditions where I juggled. It was a competitive show, local. And I won juggling the 3 sharp unbalanced meat cleavers. And then I was found by an agent, and I started working in nightclubs while I was going through college and through dental school. And I would get 1 week's bookings during my Christmas vacation while in dental school. And it was a different way of life.
That's
Now, I
phenomenal.
also, yeah. Now, I also did gymnastics and acrobatics. So when I was at Muscle Beach, I had competed in gymnastics a little bit outdoor. The equipment is outdoor. It was just a fantastic summer. I learned lots of different moves at Muscle Beach.
But you've kept up that
Oh,
fitness.
yeah. Well, uh, when I was 8 years old, the church took us to the Huntington Avenue YMCA. And it was the first time I saw a swimming pool. I didn't know how to swim. My parents didn't know how to swim. The water was up to my chest. I was scared silly. Well, after being there, I joined on my own and I said, I got to learn to swim, otherwise I'll drown. So I learned to swim and then I got on the swimming teams. The coach saw me, said, be on the swimming team. So I started swimming. Then I started doing gymnastics and acrobatics. And being brought up in the inner city, the kids in the inner city in those days, they were tough, but no one worked out in those days and no one swam in the winter in those days. So I was sort of a little different than the other kids because I was in much better shape. And when I went to college, they wanted me, I was captain of the swimming team in high school. When I went to Tufts, they wanted me to be on the swimming team. I was tired of swimming. So I said, I'm doing another sport, and I learned to wrestle. And the nice thing about wrestling is with gymnastics, you learn to control your environment physically. You're better adept. In swimming, you can control yourself in the water. And with wrestling, you can control or not be afraid of other human beings. I learned that all later because I was in a number of situations when I was confronting organized dentistry where they threatened me in different ways. And I always held my own because I don't care how big the person was in the room. If they tried to take a swing or lean on me, I knew I could take it. So I've worked out my whole life. And my 6 kids are all athletes. They're all captains of their team in high school. And to me, it's spirit, mind, body. You have to develop your mind and learn new things and push the perimeter. You have to take care of your body so you can use your mind and use your skills and human interaction and helping others, the spirit, the mind. Some people it's religion, some it's giving to others, some it's having family, but it's a combination of those things. And I think that gives one a balanced life. When I'm down and I go get my workout at the gym, I feel like $1 million. And when I learn new things and new skills, it makes a difference. And it's
Are you
really,
more a morning workout person or evening
well,
workout?
at the end of the day, I would, in the last 10 years, after work, I get to the gym between 7:30 and 8:30 and work out till 11.
Wow.
I never, and I don't want to go. Every day I say, I don't want to go. I don't feel like it. I want to go home and sleep. I go, when I walk out, I feel like $1 million. And I said, wow. And because of that reinforcement, every time I said, I don't want to go, but I know how I'm going to feel after. And it just gives you a better quality of life. And it's very important for dentists because dentists sit down all day treating a patient upside down and backwards, and you're crunched over. And heart disease is the #1 killer in our country. And if you don't exercise and get that blood flowing and work your heart, you're not going to be around forever. And you're going to have arthritis, you're going to have lots of health problems. So for dentists, I think more than any other field, it's very important to get that exercise on a regular basis.
Yeah. So your fitness has been helpful throughout your life. And you also shared with me recently, it was instrumental in keeping you alive. Now,
Yeah.
I know many of our dental students have said that they haven't personally known somebody who's had COVID-19, and you shared your personal struggle with me. And I wonder if you would be willing to share a little bit of that struggle with our students.
Yeah, I'd be happy to. It's early March of this year. I get to the gym earlier than usual. I ran for 25 minutes. I punched the speed bag and the heavy bag. I played a little handball. I lifted weights. I jump roped 110 times, the last 10 at double speed. And then at the end of my workout, I swam for a third of a mile. I left the gym. I was on top of the world. I had a complete workout. So I called my wife before I got in the car. I said, Ruth, I said, I just had the most complete workout I've had in a long time. I feel like $1 million. I said, I wonder how far I will fall when I fall. Thinking, in 5, 10, or 20 years, I'd have a heart attack or something. Well, April 1, and later, week or two later, I start coughing, I start getting fevers. April 1, I'm rushed to the emergency room with COVID. I'm put on a ventilator for 17 days. I was in the hospital in rehab for 10 weeks. I lost 35 pounds and I lost my ponytail. I almost died. I'm 81 years old. My son, who's a surgeon at Children's Hospital in Philadelphia, was on the phone with my attendings in terms of my treatment. And when you're in a hospital, you get a new attending and the residents, every couple of days, someone new. He kept telling them, he's not a typical 80-year-old. He has the body of a 50 or 60-year-old. His heart's in great shape. Don't think of him as an 80-year-old. And the mentality often these days, if you're over 80 or 90 and you're in the emergency room, do we keep this person alive? It's in the back of people's minds. I got stories on that too with my mother when she was 94, 95. So everyone said to me, if you weren't in such good shape, you wouldn't have made it. It's unfortunate that people don't understand that this simple thing, this mask, keeps you from infecting others, keeps you from infecting others. Simple as that. It protects you a little bit. If you want more protection, you get an N95 mask, which that protects you, and it protects other people. 50% of people who get COVID-19 get it from someone who has no symptoms. You can get it from a 12-year-old, you can get it from a 20-year-old, you can get it from a 30-year-old. They don't know they have it, and you don't know they have it. That's why this is so important. And you as a health professional should be role models for everyone in your community. You should be the role models. You're not just a dentist. Your life isn't 32 teeth, a tongue, and gums. You are a health professional. You should act like a health professional. If you're a smoker, stop smoking today. I will not go to a dentist or a physician who's a smoker. That person's credibility is out the window. I don't like to go to a physician or dentist who's obese or overweight because he's not taking care of himself. If he's not taking care of himself, how's he going to take care of me? So those principles have been very, very important to me. And the more you are a health professional and not just a dentist, the more you will be involved in the healthcare system. Right now, they're talking about should dentists be giving vaccinations for COVID? Well, gee, dentists, don't they only work in the mouth? Well, when I was in Vietnam, we had the whole body. When we did gross anatomy, we had the whole body. When we did biochemistry, it's the whole body. We are health professionals, but most dentists don't work as health professionals. They work as dentists only. And as a dentist, you don't want this for your perspective on life. You want to see all of life. You want to see all of your community. One of the stories I like to tell, at my 25th reunion at Penn, I was asked to be the speaker. I spoke about from Vietnam to AIDS. And at that time, the AIDS epidemic was going on. And I was on the forefront of that in Massachusetts. And after my talk, one of my classmates, who I revered in dental school, he was one of the brightest, one of the best dressed, always knew what was going on. He came up to me. He said, Myron, I feel I've been a failure. And I'm shocked because I had always looked up to him. I said, what do you mean? He said, well, I'm an orthodontist. I made lots of money. I got 2 houses. I got 3 cars. We travel all over the world, but I never gave back. I feel empty. You've helped the community. You've helped society. I feel I'm a failure. I'm in shock. I couldn't believe it. So I said, well, it's not too late. You can get involved. Get involved in your community. Get on the board of health. Get on the school board. Get involved with your dental society. Teach at a dental school. It's not too late. Now, I had another classmate at the
Did
reunion.
he? Did he?
Well, let me finish the story, though.
Okay.
He did. He started teaching. I had another classmate, an orthodontist. He was involved with the dental society. He was involved in his community. He was on the board, happy as a clam. Same reunion, 2 different orthodontists. One involved in the community, the other wasn't. And the one who wasn't ended up getting involved in the community. I don't know to what extent, but he did start getting involved with the dental school. So as a health professional, not just a dentist, you have a lot to offer. You're among the most educated in our country, among the most educated in the world. You're in the top 0.1% of people in the world in terms of your training and experience. You've got a great education at Michigan, #1 dental school in the country. Take advantage of it. Take advantage of your professors. And if you think things aren't right, most change in most schools occur because of students. Speak up, get organized. Talk it through as a group. Go to the dean, go to your professors, go to your assistant or associate deans and say, gee, this is missing in our curriculum. Oh, we should have someone talking to about X, Y, and Z. What you learn today in 5 years is extinct. There's so much new knowledge every day. Your education continues after graduation. It doesn't end with graduation. And if you don't keep up, you're going to be out of it as a practitioner, no matter what you do.
So true. So true. So to wrap things up, do you have any final words of advice for our students who are currently navigating their education during a pandemic and considering their future career options?
Okay, let me talk about career options. I have interviewed thousands of recent graduates and dentists who want a job, either to get into an AEGD program or to work in some of our programs. As a city dental director, I developed and supported 19 health center dental programs. We had over 100,000 patient visits a year, 130 personnel. So I'm always looking to hire dentists. I would not hire a dentist right out of dental school. I would hire someone who had an AEGD, a GPR, or several years of experience. Right out of dental school, that's not good enough. We have a AEGD program in Massachusetts now with NYU Langone Health. We've had as many as 18 residents. And the education you're getting today, with many dental schools, it's limited because of COVID in terms of patient care. Like at Tufts Dental School, they've cut back their staff 22% because and the number of patients kids are seeing is less than it used to be because of COVID. I would strongly recommend either AEGD or GPR. If you want to go into a specialty, I would still recommend an AEGD or GPR because as a specialist, if you have a broader sense of general dentistry, you're a much better specialist. One of my residents a year ago, sixth month in our program, either her husband or boyfriend had been in private practice for 5 years. If he had a patient who was medically compromised, had taken many pharmaceutical agents, he'd ask her about it because in her residency, she learned more about complex patients with medical problems than he learned in private practice. And that's the advantage of doing an advanced year. Now, the problem all of you have, some more than others, you're in debt anywhere from $200,000 to $600,000. So you say to yourself, gee, I have to start paying off my debt. But you'll be a much better dentist if you get another year of training. Another problem you're going to have is 2 of my residents last year called me a week or two after they were working in private practice. And they said, I'm leaving this private practice. I said, why? I said, because the dentist is insisting on us doing crowns on teeth that don't need them. I don't want to practice like that. And because you're going to be compromised financially, you always have to do what's best for your patient. I was on the state licensing board for 10 years. I'm an examiner for CDCA. Once you come before a state board because you did something that was on the edge, your life is never the same again as a practicing dentist. So when that patient is in the chair, and it's even true today, I need to meet my requirements to graduate. Do I do something the patient doesn't really need? Don't compromise your values. When you're graduating from dental school, everyone in your class will know whether you're a lousy dentist or you break the mold or you're not on the straight and narrow. And the only patients that refer to you are their problem patients, no one else. And I tell freshman students from this first year students, from this point on, straight and narrow. Don't play the edge, because by senior year, all your peers know you play the edge and they're not going to refer to you. They're not going to send their friends and family to you. And you have to have that principle always as a practicing dentist. What's best for the person in the chair, not how do I pay off my debt? And you'll be a success. As much as you're in debt, you know, the vaccine is around the corner. Things will change. Look long term. Don't think in just in terms of immediate gratification. Think long term. And you went through a lot to get this education and to get that degree and to get that license. Don't compromise it for a few dollars. Even if it's $1 million, don't compromise it for that, because your life is never the same. Your credibility is never the same again. Everyone will see you as a loser, as a cheater. Straight and narrow, what's best for your patient.
Thank you so much. Those are just really wonderful words of wisdom, eye-opening conversation. I really enjoyed this, Dr. Allukian. First, let me thank you for your service to our country. The role that you played in Vietnam was really tremendous. Thank you. Thank you for your contributions to our profession. And thank you for the millions of people who have had fluoridation and saved their teeth and had to have less pain and suffering and dental work. Your career has been really phenomenal. As you're a role model.
Okay, thank you. I just want to stress one last point. If you go into private practice, at some point get involved outside your practice, whether it's in your community. You have so much expertise and knowledge. Don't let it go to waste just on patients, but get involved in your community in some way. Be a role model for better health. Get involved with your dental school. Be involved with your alumni from the dental school. Be on the planning committee for reunions. Get involved with your dental society. And think big picture. Think big picture. You know, right now, dental therapists is a hot item. Organized dentistry has been against it from almost day one. In 2005, I was on the cutting edge of helping promote dental therapists. It's just another arm of providing care to people, like dental hygienists, like dental assistants. Dentists who in private practice who use dental therapists flourish more. They see more Medicaid patients, they have a higher income, and they can focus on the things they want to do. And the simple things like amalgams or whatever, they have their dental therapists do. But be broad-minded.
Right.
Think for yourself. Look at the data. Be science-based. That's one thing I didn't stress enough. Be science-based. Do things based on what is the data, what is the science, what is credible, and do your decision-making in that. You're going to have a lot of people trying to sell you things. Dental supply companies all, what's the data? What's the data? And live being science-based. It's truth decay versus tooth decay. Always go for the science. Thank you and good luck in your career.
Thank you so much, Dr. Allukian. You know, your emphasis on a sense of purpose, on the scientific foundation, on how you can, you know, as a profession, we need to be much more than the technical or focused area where we treat. I really appreciate that. Thank you for spending time with me
You're welcome.
today.
Happy to do it.
I appreciate our conversation and just thank you again.
Thank you. Happy to do it.